And then I usually say in general, anything that's good for the heart is good for the brain, because the blood vessels in our body obviously go not just throughout our body down here, but also throughout the brain. The brain needs healthy blood flow, and glucose and oxygen to function. Okay, yeah. So you want to know what a neuropsychologist does?
Yeah, because I've read a lot of books on like the brain and stuff too. So like there's certain things I kind of know about just as far as like neuroplasticity and like I
Right.
read some books on habit and like the basal ganglia. Like I have a little like glimpse of like the game, but hearing some stuff from the pro, like I definitely would just like to learn some
Yeah.
more.
Well, and I'm sure some of the stuff you read too, like, I'm not familiar with everything in the field. So there's kind of the big field of neuroscience,
Right.
and neuroscientists study kind of everything and anything that the brain does, from like how the cells work
A lot of
to
shit.
all the connections to some of the structures that you mentioned, like the basal ganglia. And there's so many things to know. As a neuropsychologist, I span the fields of neuroscience and psychology. So the typical definition that we like to tell people is that we study brain behavior relationships. So obviously the neuro part is brain, and the psychology part is kind of human behavior. Um, and I think a good example of how I can be helpful to somebody is, if somebody's concerned that they're having a memory problem or trouble with thinking, that could be anything from attention, language, visual stuff, anything that your brain can do. They might first go to a neurologist, and the neurologist might say, well, let's give you an MRI of your brain. So you go through the brain scan, and that takes a picture of your brain, and it can show you if all the structures are intact and make sure there's no tumors, no strokes, not anything like that. And oftentimes there's not. So then why is the person having memory and thinking problems? Well, that's why they might come to me, because I give them tests and ask lots of questions, and I try to figure out what is going on functionally. So what is the behavior that's coming from the brain that is going wrong, and why? So yeah, I test what the brain can do, the brain's function.
That's pretty fucking awesome. So you're like the middle person between like the science side and the psychology side, more or less.
Yeah. So I do mostly clinical work. Some people in my position do research, but I like working with patients to help them figure out what is going on. So mostly what I do is diagnosis, helping out with diagnosis, and then coming up with recommendations for what can be done to help this person. As opposed to, a lot of people think of psychologists as therapists, come into my office, sit on the couch, and
Ink
you
blot.
know, right, exactly. So I don't do that type of therapy. It's something I trained in, but I more sit with somebody for anywhere from 2 to, it can be up to 8 hours,
Wow.
and give them lots and lots of tests and ask lots and lots of questions to kind of get a picture of what's going on with them. Um, so yeah.
That's pretty awesome. That's pretty awesome. So, like, one thing I always wondered about is like motivation from someone who has like the psychology side of things and like the actual brain side of things. Could you explain like the science behind motivation? Like, is there actual? It could if I don't know if the question I'm asking is like a real question or not, but I'm so curious. Like, can you be like the science behind like the stuff in the brain that fires? I don't know enough. Like I know serotonin and like something, but I don't know the level that obviously.
So you're asking, like, how does the brain produce motivation, that
Yeah,
kind of
like
thing?
if you had to break down motivation to like, all right, like I hate going to the gym or something. I'm not going to always use gym references, obviously, because I'm a trainer, but I hate going to the gym. So psychologically, you'd probably ask them like, oh, some things that happened in their history or something like that. And then like on the backside of things, it's like I guess certain hormones are just not firing or.
Mhm. Yeah, I mean, so it's definitely something, that gets really into some of the nitty-gritty, but one of the main chemicals in the brain associated with motivation is dopamine.
Hmm.
So I'm sure you've heard of that. That's
Uh-huh.
kind of like what fires when something makes us feel good. So it's like the reward chemical. Um, so I don't. For some people, it's hard to know why they don't get that boost of dopamine
Hmm.
from the thought of going to the gym. Maybe they've had a negative experience with it, like you said. Um, Maybe they just haven't gotten like that. Some runners get like the runner's high from
Hmm.
running. Maybe they haven't experienced that. So there's something that they haven't experienced that has been associated with that pleasurable experience, which creates dopamine in the brain. I don't know if I can get more in
That's
depth than that.
that's fine. That's fine. It's kind of like a big question, but I've always been so
Yeah.
curious. It's one of the things that like I talk about enough and I try to figure out enough, but like just knowing like the other half of it's something I'm very curious about too.
Yeah, I mean, well, I think what might help you, like with clients, is I think back to when I was studying. It's a little bit of a tangent, but when I was studying attention deficit disorder,
Hmm.
people with that disorder have a hard time um, knowing that they will get rewards down the road if they work hard now. And that's kind of like going to the gym. So it can be helpful, instead of telling them, well, if you go to the gym for a year, you'll lose 50 pounds. Like that's way too long of a goal for them. Setting up smaller goals along the way, like, okay, this week you're going to go to the gym 5 times, and then you can have a reward of, I don't know, a cheat meal. Shorter term goals, so that they're getting a boost of a reward along the way, um, can help them maintain their motivation longer, if that makes sense.
Oh, it does. It does. So basically, you're saying having small wins lead to big battles, win to lead to big victories.
Yes.
That's good. What you heard right from the doctor's mouth, guys. You heard that one. Well, so what is like something that you with your job that you kind of um like the type of, obviously you can't tell me anything because it's clinical private stuff, but like the if someone did come in, what's like a thing that you consistently see? Is it more like depression, anxiety, or is it bigger things than that? Like what's like a day in the life with you and like a client per se with like.
Yeah. So like I've trained at lots of different places. So I've been in just general private practices where I've worked with kids. So if starting with kids, you might see their parents are bringing them in. Why can't they do well in school? You might be looking for like a learning problem or attention deficit disorder, intellectual problems. That's on the kid side of things. I don't
Hmm.
do as much of that. I work more with adults. So I've worked in hospitals primarily, some private practices, and we work closely with neurologists, and they might refer somebody who's had something like a brain injury or a concussion, somebody who's had a stroke, or they might have epilepsy, multiple sclerosis. I do a lot of work with older patients who have memory concerns. So it's trying to figure out if it's dementia or is it normal, um, or is it depression. I've also seen a lot of people who have, drank alcohol heavily for years, and now they're wondering if they have brain damage because of that. So there's usually a question of like a neurological problem, disease, brain injury, and oftentimes I am trying to differentiate that from maybe it's depression or maybe
Hmm.
it's a psychological issue, because those things can cause memory problems as well.
Wow. So yeah, you really are like the like with your field, you're like the last wall between them knowing if like it's something that's just in their head affecting them or an actual like damage to their brain.
Yeah, yeah. Oftentimes it's like the case is that it's not very cut and dry. So, sometimes it's obvious that a person has a certain problem. If they had a severe brain injury and all of a sudden they have trouble with memory, they might not need to come to me because it's pretty obvious, like that's what happened. It's more the cases where it's subtle, like they maybe had a concussion like a year or two ago and they're still having memory problems. So is it brain damage or is it not? Yeah, so more or like, an older person, they're having some memory changes, but there's nothing on their MRI. So is it they're just worried that they're getting dementia, or do they really have something going on? So it's kind of like solving a mystery.
Nice. Each day is a little puzzle for you.
Yeah, which I like.
That's good. You're definitely in the right field for it. Now, with one thing that I'm always curious about, how do you like things that you can do daily to kind of keep your brain good on the physical brain side of things? Like, what are some things that you think would keep people like healthy, normal, a healthy brain, I guess?
Well, you're gonna love the number one tip that I give everyone is, do you know?
Exercise?
Yep.
Yes. Yeah.
It's true. It's like the one thing that has consistently been found in science to actually like bolster brain function and brain structure. And they've found that it can actually help generate new neurons, which is like,
Wow.
especially in memory parts of the brain. So there's almost nothing else that they've found that can do, you know, that can help that much.
You're not just saying that because you're on this
No, I
podcast, right?
swear, I
Oh my
swear.
God, that's the best thing I've heard in my entire life.
And then I usually say in general, anything that's good for the heart is good for the brain, because the blood vessels in our body obviously go not just throughout our body down here, but also throughout the brain. The brain needs healthy blood flow, and glucose and oxygen to function. And so anything that might clog your arteries is also going to affect the blood flow through your brain. So obviously eating healthy, um, keeping blood pressure, cholesterol low.
Keep on talking.
Yeah,
I'm loving everything you're saying right now.
it's true. And especially so since I work with older people, I'm always giving this advice because older people do tend to develop risk factors because of years of unhealthy diet or not exercising. Um, but a lot of the literature really does suggest um, that healthy lifestyle can make a huge difference in your brain functioning and can prevent dementia. They think that maybe a third of cases of dementia are preventable if you just lead a healthy lifestyle.
Wow.
Yeah.
Wow. So that mind body connection's a bigger deal than they act like in school.
Yeah, it's huge.
Oh, that's exactly what I needed to hear.
Yeah, and it's never too early to start thinking about that, because things like Alzheimer's disease, they've actually found out it can start, the abnormal process can start like 20 to 30 years before you actually might
20 to
see
30 years before you see it?
actual memory problems. So, so what if you develop it around age 70? That's like it's starting in your 40s or 50s.
Holy shit.
So, it's never too early to start taking care of your health because you may be able to, if not prevent it, at least slow it down.
Wow. Wow. How do you feel about meditation?
That's actually another thing that I recommend often.
Oh, you just keep talking. I didn't do this on purpose, guys. These are genuinely questions I'm asking.
Yeah. So again, I primarily work with older adults, but it applies to everybody. It's another lifestyle factor that we recommend to help with not just relaxation and to reduce anxiety and to help with depression, but also to help with your ability to focus and pay attention to things in your everyday life. Meditation really is kind of training your ability to pay attention. So instead of training a muscle like lifting a weight, it's training your focus. If you can train yourself to be focused in the moment, focused on your breath, then that helps you to be focused on other things that are important in your life, like conversations or whatever you have to do for work. And then if your attention is strong, that helps your memory to be strong. If you
So it
can't pay
comes full circle.
attention, right? If you can't pay attention, you can't learn and remember things. So it is something that we recommend, especially when people are saying, I can't remember conversations. I get nervous that I can't think of a word I want to say. Oftentimes, they then start getting anxious, which makes it even harder for them to think clearly. So meditation in that moment is helpful as well.
Wow. Wow. Meditation, exercise. I've been preaching this stuff ever like almost every episode on the show. So like having an actual brain person talk about this right now is just like, I'm just saying I'm not ahead of the curve,
Yeah.
but like I'm in the game a little bit.
And I know there's studies out there that have shown changes in the brain as a result of regular meditation.
Really.
Yeah.
And I read something that it was like, I don't know, there's something like increased gray matter or something like that. I don't even know what that is, but like
Hmm.
I'm just for me to nerd out right now. What is that?
Yeah.
What is
Gray
like the
matter.
gray matter thing?
So so you can picture a brain, right? It has all the wrinkles on the outside.
Hmm.
So that's pretty much the gray matter. It's kind of like the substance of it, the neurons, the cells.
Okay.
There's gray matter and then there's white matter. White matter is more like the connections and the tracks that you see connecting all
Okay.
the brain. Yeah.
Okay. So the gray matter is like like the actual like so the all
Like
right,
the
so
tissue.
the
It's
tissue,
like,
yeah, gotcha. And the white matter is like
mm,
the train tracks, basically
yes.
like the stations in the train track. Okay. Now I won't forget, guys. Damn, that's fucking awesome.
It's more, a lot of people, I think, are okay with sleep, and that's great. It's more like when you have a problem with it that it starts affecting you negatively. I think one of the big things that I see all the time is people who have sleep apnea, and a big risk factor for that is being overweight. I don't know if you're familiar with sleep apnea, but
Yeah,
it's
when you can't sleep, you like choke in your sleep, I think.
yeah, it's basically where you have periods of time where you stop breathing in your sleep. And then if you're not breathing, your brain's not getting the oxygen that it needs. And you can repeatedly, it wakes you up at a level you're not really necessarily aware that you're waking up, but when you stop breathing, your brain kind of triggers you to wake up and breathe. So throughout the night, your sleep is fragmented and you can have some serious memory and attention problems with sleep apnea. So obviously, maintaining a healthy weight is important, but not everybody with sleep apnea is overweight. So it's something to just be aware of if you snore or if you just feel really sleepy during the day, to get an evaluation at your doctor to make sure you don't have a sleep disorder.
That's a big deal.
Yeah.
Yeah. And if your brain's not getting oxygen, you're definitely like not a fully functioning human then either. Like you're
Yeah. And it's dangerous for your heart too, because your heart like goes into distress.
yeah, because you're not getting that makes sense. If your heart just like not getting if you're not pumped, yeah,
Yeah.
yeah, yeah. Holy shit. That's pretty
Um,
scary.
so I guess one of the things that is kind of a big deal in my field that is, popular in the media these days is concussions.
Hmm.
Um, I don't know, like, what if you've heard a lot about it from your clients or in the
Definitely some media
fitness
stuff, but
field.
I'd like to hear some like what other gems you got for it.
Yeah. So I guess it's important for people to be aware of the fact that concussions are obviously a scary thing. And you don't want a concussion, you don't want to hit your head.
Of course.
But I think the media has kind of swung things to a point where there's kind of hysteria over it. So we're seeing a lot of people coming in saying like, I hit my head on the wall, and I think I have a concussion now. I'm permanently brain damaged.
Uh,
And it's really more like the anxiety of that that's causing problems than an actual brain injury. And the big thing with the NFL, there's the whole concussion
mhm,
lawsuit. I think I tested one or two actually former NFL players who were applying to try to get compensation through that lawsuit.
mhm,
Um, and so that's another thing that's, brought concussions to light. And I think one of the big misconceptions from that research is that all football players who have concussions go on to develop dementia. I don't know if you've heard of that condition. There was a
I've heard that,
movie.
but I did. Yeah, the Will Smith one.
Yeah. So that's another thing that that the media kind of talks about as if it's set in stone. The research is certain that if you have concussions, you're a football player, you're going to be demented. But the research is really not there yet. It's all what we call correlational research, meaning that yes, these individuals who were football players had dementia, then they donated their brains and they found problems. But what about the masses of other football players who didn't have problems? Um, there's really not solid evidence yet to be able to say that football concussions causes this dementia process. Um,
Is there anything else that's like common in the media that kind of that is not as true as people would think with the brain?
uh, well, I know there's that one myth that you always hear, like you only use 10% of your brain.
Yeah, is
Have
that
you ever
true?
heard? No, I'm not really sure. And I remember reading like how they debunked it, but honestly, like just knowing what I know about the brain, I'm not really sure where that came from. Um, the whole thing is doing something. Um, Maybe what they're referring to is the fact that a lot of what our brain does is kind of automatic, and we don't
Mhm,
necessarily have to think about everything that it does. Like reflexes and stuff. Like you don't
mhm.
think about like pulling your hand off a hot stove or something like that. But the brain, all of it is always working.
So it's always working.
It's
I
always
always
working.
took that as I always thought like maybe there was another like 90% you could just unlock. But at the same time, I think that maybe like as I like looked up more brain stuff because I'm kind of like a low key a brain nerd too. It's the ultimate muscle, so I'm like it's the one muscle that like controls all the other ones, so it's probably the best one
Mm-hmm.
to know about. But just like difference between the like your neocortex and then like the rest of your brain that everything is more like reflexive with.
Yeah.
Um um
Right. And like you mentioned, like the basal ganglia, which
mhm,
is um, involved a lot in movement. And that's probably why you're reading about it. Like fine tuning of movement. And that's more of like a subconscious level of brain functioning, but still really important. Like, for example, people with Parkinson's disease have an issue with their basal ganglia. And so, when we go to walk or take a step, it's automatic to us. We don't have to think about, okay, what do I need to do? I need to pick up my foot, then I need to move it forward. We don't have to think about that. But people with Parkinson's do because their automatic process isn't working anymore. So little things just like, how am I going to reach over and, pick this mouse up? Like they have to think about the steps.
wow.
Yeah.
I know it's like that makes so much more sense. That's why that makes so much more sense. I knew it was a thing, but I never knew like
Yeah.
what caused it. Now with
Yeah, it
things
really makes you appreciate what your brain does without you even having to try.
yeah, it does. Yeah, it definitely does. So with things that are addictive.
Mhm.
Cigarettes, alcohol, social media,
Yeah.
TikTok, whatever the thing is at the moment is. Um, what is like so the dopamine's being released in the brain from whatever that action is or doing. Is there what would you recommend for someone trying to cut back on their addiction or whatever they're doing?
I would say see a counselor for
There we
sure.
go.
I mean, that's hard for everybody. Um, with smoking cessation, it's obviously something that's gradual, and it's all about replacing the habit with something more productive, I guess you
Mm-hmm.
would call it, trying to rewire your brain. Um, I'd say incorporating meditation as well. But that's definitely a hard thing and would take like a behavioral specialist, I
Mm-hmm.
think. But also it's, being motivated, like you talked about motivation, being motivated to change. The person has to be ready, set achievable goals. You can't go from social media all the time to zero in a day. It has to be setting gradual goals, realistic goals. Um, and what's in line with your values too. Like, do you think it's better to never use social media at all, or only use it for certain purposes? So really kind of thinking through, what are my goals, um, and being patient with yourself and taking it small steps at a time.
That's awesome. So if you guys want to start a new habit, the better habits, start small. If you want to change the bad ones, go backward small. Everything's
Yeah.
small. There we go. Go backward and forward no matter what you're trying to do to make a
Right.
change.
Right. Otherwise it's overwhelming.
It is. It definitely is.
Yeah, like and also replacing the habit with something else. So if you're not on social media, what are you doing? Are you just sitting there staring at the wall? Like, maybe pick maybe say, instead of doing social media for this 10-minute period of time, I'm going to read something, a really interesting book that I've been putting off, or listen to a really cool podcast that I've been putting off. So it's kind of like rewiring the brain to go in a different direction.
Do you know how long like it takes for something to a neuron to make or rewire? Is there like a timestamp on that, or depends on the?
It's usually 17 and a half minutes.
That's it.
I'm just kidding. I have no idea. I don't know.
Oh my god! I was like, what? 17 and a half minutes?
No, I don't know.
Oh,
Takes repetition, lots
that's
of
funny.
repetition.
That's funny. Either way, that's like the one thing I try to preach to most people too. Is like, repetition. Start small.
Yes.
You got to
Yeah.
change your internal beliefs and then follow it up with actions. And
Yeah.
I mean, now we're kind of getting the science behind it too.
Yeah. And the other thing is, so I know you talk about mindfulness. I don't know if you've heard of, there's something that incorporates mindfulness called acceptance and commitment therapy.
No, teach me.
Um, so it's a lot to teach you right now, but I think the big piece that I like about it is, sort of clarifying what are your values. So having like at the center of all of your goals, what is it that I actually value? So like, why do I even want to exercise more? Why do I want to eat healthier? Um, is it because I care about my health? Like, is it because I don't know? Like, think like, what's a value that you think would underlie
Oh,
health
why?
and
Like just for me personally?
yeah,
Um, I think I want a long life. I think that's
yeah.
like that's a
There
good
you go.
good one to keep me
Right.
in check.
Or mental health, lots of things. So it's about kind of remembering that value and knowing that, even if I don't feel like going to the gym, I want to live in line with my values all the time. So always kind of remembering that you're moving in that direction, and it's never a goal that you can finish. You always have that value that you're following.
Values don't have any deadlines or don't have any time
Right.
slots. They're always with you there because of who you are.
Right.
Oh man, yeah. See, I'm glad everything you're saying right now. I'm like, good. This is good to hear again. Like, I'm like, this is what I think, but I just didn't know like the science behind it. So
Yeah. And the other thing with values too is that, a lot of times people say like, oh, I'll start exercising, when I feel better, or like when I'm not so tired all the time, or when I'm not so busy all the time. Um, but bringing it back to your core value is like, okay, I can have this thought that I'm too tired, but I can also move in the direction of my values and kind of leave that thought be.
so you're so the so your thoughts, your values are always like, your values are your most important thing overall. They're like
Compass.
there we go, the compass of you, of how you are. And then your thoughts are like the little, like, I don't know, cars driving around, or ducks.
Yeah. Yeah. Those metaphors?
Some of them, that I just made that one up, but like that's
Oh,
how I
that was
think most. That's how I think most of
good.
the time. So you
Right.
know, if you for the, as far as like thoughts, is there anything you could think about as far as like the psychology side of like keeping your thoughts in a better space than a worse space? Like, because we all have our negative thoughts, like you're an
Mm-hmm.
idiot, we hate you, blah blah blah.
Mm-hmm.
What do you, from your perspective, what are some of the things you have people do to like kind of just on a general things that you have them do to help them like think better?
Yeah. Well, so I don't do a ton of therapy, but I still learned a lot about this in school. And, there's kind of two approaches you can take. You can try to make those thoughts go away.
Mhm.
You can try to kind of analyze the thought, like, okay, take the thought, I'm an idiot. Well, what's the evidence for and against that? You can kind of analyze it and come to the conclusion, like, okay, well, maybe I'm not an idiot because I'm really good at this, and I did well in school, and all that stuff. But inevitably the thought's probably going to pop up again. It's just our brains kind of just work that way, and it's hard to get that thought out of our head, especially if we're having a bad day or we make a mistake. It might pop up. So the acceptance approach is being able to be okay with the fact that your brain is saying this thing and not attaching so much to it, just like you said, letting it pass on by like the cars. um, and still, living a valued life while having these stupid thoughts. Like you don't have to listen to them. They're just kind of strings of sound, um, that are kind of arbitrary, and they don't have to dictate your actions.
They definitely don't have to dictate your action. It's absolutely true. That's
So yeah, I'm more
absolutely
of the
true.
proponent of kind of like, you know, allowing them to pop up and be there, and that's okay. You don't have to fight with them. I think when you start fighting with them, that's when it becomes a struggle. If you just like let it be there and go about your day, like eventually you're going to focus on something else. And then that'll lead to a better mood and ultimately less negative thoughts and feelings.
Awesome. Awesome. So you heard it. You heard it here first, guys.
Are you also interested in like some of the like weird disorders and stuff?
Yeah.
Like that's what got me interested in the field. Like, I think it's called phantoms in the brain. It talks about things like phantom limb syndrome. Have you heard of that?
When you like get something cut off and you still feel it.
Like that kind of stuff is what made me really interested. Or like people who they can see fine, but like for whatever reason, their brain doesn't process one side of space. So like if you give them like a plate of food, they'll only see half of it and only eat like half of the food on their plate. Or like if you tell them to like draw a clock or something, only draw half of it. Like interesting stuff like that.
And they
Like
live
that's what.
like that.
Yeah, I mean, some it usually gets a little bit better. It's like after a stroke or something, but yeah, I love that stuff.
Have you seen any people like with that? Like,
So who have I seen? I mean, I've seen people with, they call it neglect, not as like cool as the stuff you see in the textbook where like where they're only drawing like half of a clock or something. But I've seen people like after they've had a stroke where they'll only kind of face one side of the room because it's like the other side of the room kind of doesn't exist.
Oh shit.
Um, yeah, usually that heals somewhat. Some of the other interesting stuff, it's like people, if they've had a stroke but they're not aware that maybe their arm isn't working, so they'll tell you, yeah, my arm works. So you'll be like, okay, so can you raise it in the air for me? And they won't. And you're like, okay, so does your arm work? Yeah, it works fine. So do you think you'd be able to pick something up with your hand? Yeah, I can pick something up. um, or they'll go to walk down the hall and they're like veering towards one side but they're not aware of it. um, yeah, some interesting stuff like that.
Holy shit.
Um, one of the interesting things I've seen is called Capgras syndrome. It's French, where people, so for example, if I had the syndrome, I might see you and I'd be like, you look like Dom, but you're not Dom. You're an imposter. You're somebody in place of him, but you're not really him.
And they
So people,
believe that genuinely?
yeah, because so you mentioned the amygdala, so it's like a disconnection between the area that recognizes faces and like the emotion centers of your brain. So I see you, but I don't have the same familiar emotion that I used to get. Like, so I feel like I don't know you. You feel like an alien to me. So I think you're an imposter.
Holy shit.
Yeah.
Have you met people like that?
I've met, yes, I've met somebody who they thought there were multiples. She thought there were multiples of her husband because there were times when he didn't feel familiar to her. So in those times, she thought it was like an other version of him.
You can have that
Yeah.
and still be functioning like as a normal person, or you have to be in like a certain
Usually there's something that's happened to the person. So like was she had a certain type of dementia, but
Okay.
like she was still able to have a conversation with me enough that she was able to tell, like, to speak to me and be like, yeah, there's multiples of my husband. It is what it is.
What about like split personality disorder?
So like dissociative,
Right. I think
like
that's what
there
real
was a
name.
movie recently where
Yeah.
the guy had like 24. So that's actually, it's controversial.
Really.
It's definitely not common. I had one professor who said it was complete BS. But then you read things in textbooks that say like a person can have one personality that isn't allergic to something, and then they switch to another personality and it is allergic to something. Like they'll break out in hives when they. So, there. I know there's some researchers like at Rutgers that deal with it. It's not. I think I saw one guy in a nursing home who we thought maybe he had a split personality, because there were times when he would talk about himself like in the third person.
Mm-hmm.
And he would say that he had a twin who was doing things. So he'd be like, no, that wasn't me that tried to pack up my things and leave yesterday. That was my twin. So it was possible there was a split personality.
But it's not like the movie.
I've never seen that, and I've never heard of anyone who's seen that. But I wouldn't say that it's
Nothing's impossible.
right. Like, when I think people who have had like serious trauma as a child, unfortunately, might experience something like that, but not common.
Wow. I was really well, at least now like I have more of a real life perspective. The movie made it look, I was like, oh my God, you can just walk around and be like, today I'm
Yeah,
Patricia.
right. That was on today. Actually, I think it was today. My husband was watching it,
Yeah, it's a
and I got
classic.
sucked in because even though it may or may not be real, I still am like fascinated by that stuff.
So good. Such a good movie.
Yeah. I'll tell you one more cool thing.
Yes.
All right. So When I worked in the hospital, we did evaluations of people who had epilepsy that medication didn't work for. So it's called intractable epilepsy because it's not treatable with
Oh,
medicine. So they've tried multiple medicines and they're still having seizures and it's affecting their everyday life. So they come in and they're being evaluated for brain surgery. So the surgeon would go in and actually remove the part of the brain where the seizures are coming from.
okay.
Um, so obviously before they do that, they have to do an extensive workup to make sure they know where the seizures are coming from because they don't want to go in just cutting like randomly or accidentally. Um, and so it's really important for them to figure out where in the brain language is located and memory is located. In most people, language is on the left side of the brain, but there's a small number of people where it's on the right side of the brain. And sometimes people who have had seizures their whole life, their brain might reorganize itself so
Oh
that
shit.
because if you have a lot of like bad stuff going on one side, well then the brain will be like, okay, well I'm going to put language over here because it's an important function. So so what they do to try to figure out what would happen if they cut one side of the brain or the other is they bring someone into an operating room and they inject them, I think through their femoral artery with this medication that basically puts half of their brain to sleep at a time. So like it's like
Only half?
yeah, so it's like anesthesia, but for only one half of the brain at a time. I know it's. I don't understand exactly how they can keep it so localized. I guess it's really fast acting, and somehow it goes to one side, and whatever, it works. So me as the neuropsych, I was an intern, but I helped out as a neuropsychologist. We go in the room and we have about 3 minutes to test this person while half of their brain is asleep to figure out if so if we put the right half to sleep and the left side's awake, can they speak? Can they understand what I'm saying? Can they remember things? Then they do the other side. Um, so it's one of the most intense things I've experienced. And
Is the person
the
okay? So they're just sitting there with half their brain. Like, what are they even?
sleep, it's stressful. So the person like they're in there and they have them raise both of their hands up, and then as they do the injection, one of the arms starts falling down because like one side of the brain affects the opposite side of the body. So that's how you know like the brain's starting to go to sleep. Their arm will like fall down. Um, and usually they're kind of confused. There's some people that get agitated and try to like stand up off the table. You're like shoving stuff in their face, like, here, can you read this word? Can you read this word? Can you count for me? Like, do you understand what I'm saying? um, and then once the anesthesia wears off, you then have to test their memory. So you say, do you remember any of the words that I gave to you while you were, you know, half asleep? Um, and if they do, then that suggests that that half of the brain works for memory and language. If they don't remember whatever you gave to them, then maybe that part of the brain, you know, doesn't work as well for memory and language. So then that helps the surgeon decide, like, should I go in cutting this part of the brain, or is it going to leave them with memory problems or language problems?
That's insane.
Yeah.
You can turn off half. You can turn off
I know.
just turn off half the brain.
Isn't that scary though?
That's
That would
horrifying.
scare me. I know.
What if you turn off the full brain? What if you did both? Then you
Well,
just like, are you,
that would be full anesthesia.
oh yeah, it would be.
Which also is kind of scary, but yeah,
My brain is
right?
fucked. My brain is fucked up right now. Just hearing that. Holy shit.
Yeah,
Oh my
that's
gosh.
pressure. That's pressure
That
right
is
there.
pressure. And you had to deal with those people just like helping them with the thing and like,
Yeah, fortunately, I was just the intern and like I wasn't
shit.
like the main person responsible because I was so nervous. Like I'm trying to take notes on this person and I'm like so stressed out that I'm like making mistakes on what I'm writing down. It's like,
Holy shit.
yeah.
That's literally fucking horrifying. Oh my gosh. Oh
But
my gosh.
ultimately, it usually helps the people because a lot of times the surgery does help. So that's good.
That is good. And then with the just to go back in the right and left half of the brain, one's
Hmm.
usually more like math and one's more like artsy too, right? Or is that a myth?
Yeah, um, I so it's I guess that's kind of a simplification. I think left and right side they both control like aspects of math.
Hmm.
And then with art, I mean, I've heard the right hemisphere thing, and like the right side of the brain is more like the visual side for sure. But you definitely need both to be
To do
able
either one.
to do different things. Um, like I have people copy pictures of like shapes. Um, so let me see if I can real fast. Like, so it might be like something like this is terrible. Can you see that? Okay. No, you can't really see it.
No, I can.
Okay. So just like a square with a triangle or something.
Hmm.
So I'll be like, copy this shape. So a person, if they had damage to the right side of their brain, then they might not see how this whole thing goes together. And they might draw like just like a square disconnected from a triangle.
Really?
So yeah, so the right side kind of helps you see like how it all goes together. I know it's like too bright. And then the left side is more like the it sees the details.
Oh,
So you really do need both.
shit. Yeah, I didn't know that.
Yeah.
Wow. Yeah, we're definitely you have coming on again pretty soon. Like we're doing 2 more episodes.
Okay.
This has been fucking awesome. Like, thank you so much for being on because this is like I'm gonna have more questions for you though too though.
Okay,
So
yeah.
I'm gonna come in like ready just to nerd out and we'll just nerd out on
Yeah.
here.
Yeah, you can ask me plenty of stuff.
So Megan, thank you so much for being on the show. Really appreciate it. And
Thank you so much for having me.
no, I had a blast, learned a lot. Megan doesn't have a business card out here yet for you guys, but when she's the has her famous thing in a couple of years, you guys will follow her then.
Yeah, until then, take
Until
care
then,
of your brain.
there we go. Take care of your brain. You heard it here first, guys.
So
Thank
you
you
don't
so
have to
much
be
for
in my
listening.
office.
Yes, don't want to be in her office. Thank you much for watching, guys, and take care.